Hi all, I'm Dr. Anju Shukla and I'm Professor and Head Department of Medical Genetics at Kasturba Medical College and Hospital Manipal. And today I'm here to talk about rare genetic disorders. So what is a rare disorder? A rare disorder is a disease condition which is lifelong and which is present in one or less than one individual per thousand population. And out of these rare disorders, 80% of them have an underlying genetic cause. So let's understand why rare genetic disorders occur in any individual. Let's go back to the basics. So all of us are made up of millions and trillions of cells, and inside these cells there is another small part that's called as a nucleus. The nucleus harbors our genetic material, or some of us know that as DNA. So this DNA is compressed into another form of structures. They are called as chromosomes. They look like small rods, and we all harbor 23 pairs of chromosomes, that is 46 chromosomes overall. Why these chromosomes are in pair is because one of this pair we receive from our father and the other from our mother, and that is how we get 23 pairs or 46 chromosomes. Within these chromosomes lie smaller units that we call as genes. Every gene mostly makes one functional protein, and this protein is actually the building blocks of life. So if there is any defect in the genes or the chromosome, that will lead to formation of these abnormal proteins, resulting into disorders that we call as rare genetic disorders. So how do we come to know that anybody has a rare genetic disorder? So there are some symptoms which will help us to know whether anybody is affected with these disorders or not. So these disorders, depending on their severity, can present any time in life. So nowadays, with the advancement of technology, we see that these disorders can be picked up as early as in utero. That is, whenever anybody is undergoing a antenatal or a scan during pregnancy, there are some defects that can be picked up, and then some of them we know have a genetic cause. The others may be picked up when the child is born and the child is born with birth defects. The other time when these disorders can be observed or they can be symptomatic is during childhood, and some of them can appear in late adult life as well as in the old age as well, depending on the disorder. So it is important to know what and how these disorders have occurred. So what we do is that we confirm these disorders by doing genetic tests. So all the sophisticated genetic tests that is available anywhere in the world are available at Kasturba Hospital as well. And the first step of managing any genetic disorder is to get a confirmed diagnosis. Once we get the diagnosis, then we are able to tell them the prognosis or how the disease is going to be in the future, what are the treatment options that are available, what can be done to manage it in the best possible way if there is no definitive cure for this condition. The other important aspect is of prevention. So if these disorders are diagnosed, they are confirmed in the family, and these disorders are likely to occur in either the next child or in the next generation, it is possible to do a prenatal testing when the mother or any woman in the family is pregnant, and then to find out whether baby in the womb is affected or not by doing the testing that we call as prenatal diagnosis. So I would just like to reiterate again that it is important that any individual who has any kind of prolonged illness that is not explained by the normal illnesses or the tests have come out as normal, and there are some features like there is a lot of developmental delay, unexplained weaknesses there are birth defects, there are features of autism, any kind of chronic eye disease, any kind of chronic lung disease, when children are born with congenital deafness, all these are indications that they should see a geneticist. Thank you very much.